For this episode, I'd like to do a little bit differently. Condition-specific video. There are so many patients I've seen in my practice have asked me the same question over and over again. How do you know whether you have a partial tear tendon? And if you do have one, what are you going to do about it? Hi, this is Cody Zan, and I'm a licensed acupuncturist at Body Option Clinic. And I'm also a founder of Body Option Clinic in Vancouver, BC. So the first thing I'd like to talk about is how do you know you have a partial tear tendon without having to see a doctor, without imaging, or without being examined or assessed by healthcare professionals. It's such a frustrating condition. Most people, they don't know about, or maybe they do know about, but not so many options out there for you to feel better and get better results. Majority of my patients have been seeing physical therapists, doctors, seeing massage therapists, chiropractor, acupuncturist, whatever you name it, and they see very little results. The return just very minimum or close to zero sometimes. It's such a crucial step for you to have a successful healing. For a partial rupture or a partial tear tendon, if it's not treated properly, eventually it will turn into tendinosis, or you can just keep having the same partial tear tendon for a long time. Well, one of the very fundamental thing you need to know about a partial tear tendon is a tendon is a very strenuous, and it's a very strong, very sturdy architecture in our body. So our muscle attached to a tendon and tendon attached to the bone so that we can move. Like for example, I have my biceps here. So biceps have two heads, the long head and the short head. So each head has tendon and a tendon attached to the tibia. When I contract my biceps, then I can move my arm, or we call flexion or extension. So we can move the joint. So when you have a partial tear tendon, first sign is pain. You will feel pain, and I would say particularly it feels more like an ache. So there's a difference between pain and ache. Well, we'll have another video talk about pain and ache and soreness. But for this video, we're just going to focus on the ache in the area you suspect where you have a partial tear tendon. The second sign is tenderness. There's a local tenderness in the tendon. I'll give you one example. Last year I played volleyball. There's a lot of jumping up and down, and also play a lot of basketball too. And during the basketball game last year, about May, I had a pain in my patella tendon. Initially, it felt like I couldn't bend my knee. The second day, my knee started to feel swollen, tender to touch. It was painful. So I suspect that it might be a partial tear in my patella tendon, and eventually I confirmed it by MRI. It was a partial tear, and of course it took me a while to heal it. From my first-hand experience, I know pain or soreness and tender to touch would be the first two signs you will notice. The third sign is you have limited range of motion, or when you load weight on the tendon, it will feel weak and it will trigger pain. So what I mean by that is, let's say if you have torn a partial rotator cuff on your shoulder and you didn't know about it, and let's say if you're about to lift something off, I don't know, let's say something off the cabinet or maybe something off the shelf, and then you pick it up and then you feel there's a deep ache and pain in your shoulder. And that's another sign of a partial tear. So depending on the area, if it's in the knee, it will be bending and standing and jumping. And if it's the shoulder, rotator cuff tendon, it'll be anything to do with overhead movement, lateral raises, and maybe sometimes even just arm wrestling. So those can trigger pain as well. So now we're done talking about some signs that you might have a partial tear tendon. But if you do have one of those signs or combination of those signs, and I highly recommend you to see your own doctor or physical therapist for an assessment to examine and assess. So this is just for information and education purposes. Now, so during my own recovery journey, as well as my patients, I find that there are 3 things we are missing that stop the tendon, or it prohibits the tendon to have a successful healing journey. And I'd like to share with you about those 3 things. So the first thing is L-Citrulline. So L-Citrulline is one of the amino acid group that we need to consume on a daily basis. Unfortunately, we do not consume enough of the L-Citrulline in our body. Therefore, when we are experiencing trauma or your tendon require excessive amount of blood and oxygen for healing, as we all know, tendon and ligament tend to have inadequate or low volume of blood flow. Especially when you injure or have a partial tear, it requires more blood and oxygen to the region to have a fully recover journey. When you have a decreased amount of blood flow and oxygen in the tendon, and your tendon is not going to heal as fast, it's going to be constantly achy and sore, and you have a chronic inability to do certain things. And so at that time, I would highly recommend you to take L-Citrulline, because L-Citrulline can increase the nitric oxide. And nitric oxide is the precursor to enhance and dilate capillaries and blood vessels. So in other words, the L-Citrulline can increase blood flow to the region that requires more blood and oxygen for healing. And the second one I would suggest would be Graston, manual therapy for the local tendon, which is partially tear. Graston tool, it's an instrument that we use in clinic to scrape onto the surface of the skin to trigger blood flow and reduce adhesions from forming, because adhesion can also prohibit the blood flow to the tendon as well. So once the adhesion has been formed, and the blood flow to the tendon or ligament will be decreased. Therefore, I do recommend to use Graston for the local tendon where you feel aches and sore. You just need to do it once a day just to increase the blood flow and oxygen. But if you don't have the Graston tool, we can be creative about it. I would suggest you to use a silver spoon or any kind of spoon, just to use not so edgy part of it, so that it doesn't hurt your skin, so it doesn't cause any irritation on your skin, and you can still get as long as you get the skin mildly red and feels a little bit warm, and that's how you know the blood flow that's getting into the tendon. So the third one, or the final one, tip, a Boswellia. So a Boswellia is a plant, has anti-inflammatory properties. For most of the tendonitis is that the problem for a complete healing is there's a chronic inflammation. If the chronic inflammation persisted, and it will cause swelling, and it will also decrease blood flow as well. So remember, we talked about the tendon and ligament tend to have inadequate amount of blood flow, meaning there's very low volume in blood flow to the tendon and ligament. Therefore, the recovery tend to be slower. On top of that, imagine if the tendon is chronically inflamed. The inflammation causes the tendon to be swollen and tendon to touch and pain and a bunch of different symptoms. After that, if we don't fix the inflammation itself, it will cause decrease in blood flow and oxygen, and it will become a vicious cycle. So you get more inflamed, and then you get less healing factor, and it gets more inflamed. So it's a vicious cycle. In order to break that cycle is to intervene that process. Depending on the doctor you're seeing, I mean, some doctors recommend painkiller, anti-inflammatory, NSAIDs, something like naproxen, ibuprofen, that kind of medications. However, for a partial tear tendon, it tends to be a longer journey. It tends to be anywhere between 6 to 8 weeks. If you were to take 6 to 8 weeks of painkiller, it's going to be really, really harsh on your stomach and your gastrointestinal system. For something like that, that's why I do recommend to take something natural and doesn't hurt the body as much and still have the similar benefits, which is Boswellia. And you can buy Boswellia supplements from any supplement shop. It's rather cheap and effective. And it also helps to reduce stiffness. So stiffness is one of the symptoms that come from the inflammation itself. So I'll also put the link below the video so that you can check out the Boswellia and Graston as well as L-Citrulline. So you can go to the supplement shop, your local supplement shop, and buy them. So that would be the tips for the partial tear tendon today. And I hope you enjoyed that. And I'd like to hear your thoughts on what you'd like to know or what you'd like to hear about in terms of musculoskeletal injuries and conditions that you're suffering, or something that you'd like to ask about. So I'd like to see your comment in the video, and I'll see you in the next episode. Thanks.